In a case of wrist or hand pain, using our mnemonic old cards, we'll note the onset. When did your pain start? Did it come on suddenly or was it more gradual? And do you remember what you were doing at the time? For the location, we'll ask our patient to point with one finger. For the duration, we want to know if your pain has been constant since it started or if it's more intermittent. If that's the case, we'd like to note the frequency. That is, how long does an episode of your pain last for, and how many episodes have you been having per day or per week? Next, we can note the progression. Does your pain appear to be occurring more frequently or more severely? Or if there has been no progression, we'll also want to state that in our patient note to show that we've asked. To help characterize the pain, we like some descriptors, sharp or dull among others. And since this can involve the nerves, as we'll see below, we'll ask about any numbness, tingling, or motor weakness, aggravating and alleviating factors, radiation, treatments tried, and severity on a scale of 1 to 10. And again, if there are no aggravating and alleviating factors or radiation, we'll also state that in our patient note to show we've asked. We'll break down our case of wrist pain into traumatic and atraumatic causes. For all cases, let's order a CBC, serum electrolytes, an X-ray of the right or left wrist, and if we have any neuropathy, as we'll see above, a nerve conduction study and an electromyogram. In a wrist dislocation, our supporting points include wrist pain, an onset that's sudden after a fall or trauma, and aggravated by movement, and as we'll see in our physical exam coming up, a decreased range of motion. In a wrist or carpal fracture, we'll see a wrist pain, an onset again that's sudden after a fall or trauma, and since the fracture can involve the underlying nerve, we could note a neuropathy, or a numbness, tingling, a sensory loss, or motor weakness. It will be aggravated by movement and will find limited relief by conservative management because the underlying fracture hasn't been fixed, and we'll also see a decreased range of motion. In osteoarthritis, we'll see wrist pain, an onset that's now more gradual but progressively worsening, and classically it will be alleviated with rest and seen in an older patient. In a cervical radiculopathy, we'll find wrist pain and now with neck pain as well, producing a radiculopathy, for example, from a herniated disc. And we'll see unilateral radiating pain, numbness, tingling, or motor weakness. It can be aggravated by movements and alleviated by sitting still. And if the disc is compressing the foramen, we can find lower motor nerve findings, including delayed deep tendon reflexes. Also, we can note a positive Sperling sign in our physical exam, and we'll add here to our workup an X-ray of the cervical spine and MRI of the cervical spine. In a carpal tunnel or a median nerve compression in the wrist, we'll find wrist pain with a neuropathy as well, numbness, tingling, a sensory loss, or motor weakness in the median nerve distribution, the first 3 digits, and it will be aggravated by wrist flexion or extension, for example typing, but alleviated by shaking. We'll also note a positive special test in our physical exam for Fallon and Tinel. In median nerve entrapment at the forearm, we'll find as well wrist pain, possibly a neuropathy, numbness, tingling, sensory loss, or motor weakness in the median nerve distribution, the first 3 digits, and now as well in the forearm. And it will be aggravated by elbow flexion. In ulnar neuropathy at the wrist or ulnar neuropathy at the elbow, we'll find wrist pain, a neuropathy, numbness, tingling, sensory loss, or motor weakness now in the ulnar nerve distribution, either the 4th and 5th digits and or as well in the forearm, and it will be aggravated by elbow flexion. In de Quervain tenosynovitis, we'll see wrist pain in the base of the thumb, and it will be aggravated by thumb activity, for example gripping, and as we'll see in our physical exam coming up, we'll have the positive special test of Finkelstein. In rheumatoid arthritis, we'll find bilateral wrist or finger pains, and it will be aggravated in the morning, high yield morning stiffness, and alleviated with use. We could also note systemic symptoms in our review of symptoms, including fatigue, fever, or weight loss. We could also see a positive family history. We'll order ESR-CRP, rheumatoid factor, and anti-CCP antibodies. In systemic lupus erythematosus, we'll find wrist and finger pains, a malar rash, oral ulcers. Our patient can also be noting or complaining of photosensitivity and Raynaud's or blue fingers in the cold or times of stress. And as well, we could see systemic symptoms in our review of symptoms, including fatigue, a fever, or weight loss. We could also note a history of abortions in our OB/GYN histories. We'll order ESR-CRP, an ANA, anti-double-stranded DNA antibodies, and anti-Smith antibodies. In crystal arthritis, we'll find wrist pain, and now with erythema, warmth, and swelling noted in our inspection and palpation. For gout, we could see podagra in the big toe or tophi deposits, crystals in the ears or behind the Achilles. Our patient will also have a history of heavy drinking or diuretic use, and in pseudogout is typically found in an older patient population. And we'll order ESR-CRP, arthrocentesis for gram stain culture and microscopy, and a serum uric acid level. And finally, in septic arthritis, we'll see a wrist pain, and now with a fever in our vital signs, and as well in our inspection and palpation, we'll note erythema, warmth, and swelling. And in the gonococcal form, commonly in females because they can be asymptomatic gonococcal carriers, we'll see a characteristic pustular rash and a history of STDs or multiple sexual partners. In the non-gonococcal Staph aureus or strep forms, we'll have a history of skin trauma, abrasions or cuts, diabetes, or IV drug use. And we'll add to our workup here blood cultures.
For the wrist physical examination, same rules apply: inspection, palpation, range of motion, muscle strength, sensation, reflexes, and pulses, and a special test when indicated. So I'm going to sanitize my hands. I want them to be dry before I begin my exam. Okay. They are now dry. So you mentioned you had a pain in your wrist?
Yes, I was
Which
having
one?
wrist pain, my right wrist.
All right. So I'm going to examine it, okay?
Thank
If
you.
at any point it hurts, just let me know, okay?
Okay.
All right. So let me just inspect. I don't see any redness, any swelling, any visible lesions. I see a little scar on the dorsal aspect of your right hand. What happened there?
I fell when I was young. It's been there since.
All right. Thank you. So you have to notice everything and ask questions on your exam. Okay, so inspection is done. So I'm going to go into the palpation, the radial aspects, ulnar aspect, and I'm feeling the dorsal aspect. Do you have any pain?
A little bit when you press
Okay. What parts do you feel the pain?
on this side.
Okay, on the radial aspect. Thank you very much. Okay. So that's the palpation done, and now time for the range of motion. So can you just do as I do, okay? Can you do this? Flex? Yes.
It hurts a little bit.
It hurts? Okay. Let me see you do it on the other hand too. Okay. Can you extend? All right. Now, can you do this for me? Okay, so I see there's some weakness of this hand. Can you go this way for me? Thank you. And I'm going to check for grip strength. Can you grab both my fingers as hard as you can? Okay, there's, thank you. There's also weakness in the right hand as well. Thank you very much. I'm also going to assess the joint above and the joint below, technically the fingers. So, can you do this? Flex, can you extend? Do that. Now, can you do this? Can you do that? Okay. Now, normally you do it on both hands, on both arms, I mean, but in the interest of time, I'm just going to go with one. All right. So now for the fingers, can you do this? Can you do that? Make a fist, let it go. All right. So I've assessed the range of motion in the fingers as well. Now it's time for muscle strength. All right. So I'm going to have him do this. Go up. Both. Yes. Now pull towards you. Push. Okay. Any pain when you did that?
No.
All right. So I want to do something for me. Can you do this? Now push down my hand, which you okay. Let's do it on both hands so I can demonstrate to you. Okay. All right. So I see that the left is stronger. Now I felt the right pushing against my hand, but was not strong enough to overcome my resistance. I'll call this a 4 out of 5 muscle strength, while this is a 5 out of 5 muscle strength. Okay, so do this. Go up. Yes. Same thing as well. Okay. So yes, you can relax your arm. So that's the muscle strength done. I'm gonna go into sensation. Can you close your eyes for me? Do you feel that?
Yes.
Do you feel that?
Yes.
Are they the same on both sides?
Yes.
Okay. You feel that?
Yes.
You feel that?
Yes.
Sharp or soft?
Sharp.
Same on both sides?
Yes.
Okay, so I've just assessed the sensation. So time for reflexes. So, okay, I'm going to isolate the tendon. 2 plus. Just relax. 2 plus. See this one? Just a little. Okay, so 2 plus overall. And then I'm going to move on to check the pulses, the radial pulses. I'm going to add an additional test afterwards, which you're going to see. So I'm checking the radial pulses. Okay, strong pulses on both sides. And I'm going to add a test called the Allen test. The Allen test is to check the patency of both the radial and the ulnar arteries. In the interest of time, I'm going to do it with one hand. So I'm going to isolate the radial artery. Yes, I can feel that. And the ulnar artery. Somewhere around these areas. And I'm going to hold tight. I'm going to tell him to clench his fists hard, like 5 times. Keep doing. Keep going. 2, 3. Show them, okay, open. You see how pale it is? Show them your other hand. Can you compare? You see how pale it is? Okay. So I'm going to let go. You see how color has returned? Full color has returned. Patent radial and ulnar nerves, ulnar arteries, excuse me. All right. So that's for the Allen test. I'm going to go into the other special tests. So the other special tests will be to check for things like, the quadrant tendonitis. Okay, so I'm going to have him do the Finkelstein test. The Finkelstein test is, I'm going to make him do this. Can you do this for me? Okay, and radial deviation. Do you feel any pain?
Yes.
Okay, I'm sorry. Okay, so I'm going to check for carpal tunnel syndrome, the Tinel and the Fallon test. For the Tinel test, I'm going to tap over the flexor retinaculum. You feel any pain?
Yes, a little bit.
Okay, sorry. And the Fallon test, I'm going to have him do this. So can you do this for me? No, on both like this? Good. So I'm going to have him hold it for 1 minute, usually, but in the interest of time, I'm just going to demonstrate it. If it's positive in both the Tinel and the Fallon test, you're going to feel some numbness and tingling coming down the hand. Do you feel any of that?
Yes, I do.
Okay, sorry about that. So you can let go. All right. So I'm done with the wrist physical exam. I'm going to ask the patient if he has any questions for me.
Yes, doctor, do you think I'll be able to use my wrist like normal again?
Yeah, from the history and physical examination, I think there's an inflammation going on with a tendon in there. It seems that you might be carpal tunnel syndrome or something else, maybe just a tendon inflammation. I'm not sure yet, no way to know for now until, we do some other studies to see what's going on in there. But otherwise, these are benign conditions. You'll be able to maintain full use of your arm. Okay, I understand that, it might be concerning for you because of the way it feels, but I'm sure you'll be fine.
Thank you.
All right. So, and that ends the wrist physical examination.